Well, I know we're doing this a little bit backwards, but I do think we should do a deep dive into diverticulosis. Now, we briefly talked about this in the last lecture about diverticulitis, but diverticulosis is a common condition, particularly in older adults, characterized by the formation of diverticula, which are small, bulging pouches in the lining of the digestive system. These pouches most often develop in the lower part of the large intestine, the colon. Diverticulosis in itself is generally asymptomatic, but it can lead to complications such as diverticulitis, where the diverticula become inflamed or infected. So, diverticulosis affects approximately 50% of individuals over the age of 65 in the US. It's worth mentioning that only 10 to 20% ever become symptomatic. The exact cause is not known, but several factors may contribute to the formation of diverticula. These include a low-fiber diet, which can lead to constipation and increased pressure in the colon, as well as aging, obesity, smoking, lack of exercise, and certain medications like NSAIDs. The pathogenesis of diverticulosis is thought to involve increased intraluminal pressure within the colon, leading to the formation of diverticula at weak points in the colon wall. These weak points are typically where the vasa recta, those are the small arteries, penetrate the colon wall. Now, a low-fiber diet may increase intracolonic pressure due to smaller, harder stools that require more force to move throughout the colon. So, if you're constipated, this is saying if you're constipated, don't hold it. Go to the bathroom. You're helping your colon and your future self will thank you. I promise you. So how are these patients going to present? Most patients with diverticulosis are asymptomatic. However, some may experience mild symptoms such as bloating, abdominal pain, or changes in bowel habits. These symptoms are nonspecific and can be associated with a variety of gastrointestinal disorders. So how are we going to diagnose diverticulosis? Now, it's interesting. Diverticulosis is often discovered incidentally during diagnostic procedures for other conditions. The gold standard for diagnosing diverticulosis is colonoscopy, which allows direct visualization of the diverticula. But other diagnostic methods such as CT scan and barium enema X-rays can be used. And what's the treatment for diverticulosis? Well, for asymptomatic diverticulosis, treatment focuses on dietary changes to include more fiber, which can help in reducing the pressure, intraluminal pressure. It's worth mentioning that diverticulosis is self-limited and managed with high fiber diet and stool softeners. So that pretty much covers diverticulosis. It's very important that we do have a clear picture of everything about diverticulosis because it can lead to diverticulitis. Big takeaways. If you have to go number 2, don't hold in the poo. In depths of the gut, a story unfolds of pockets and pouches that quietly hold a tale of diverticulosis where sacs gently lie. In the colon's embrace under that digestive sky, tiny bulges in the lining like caves so small, harmless, and silent they bother none at all, a landscape of tissue where fibers should roam, in this secret garden where seeds should not be sown. With age, they whisper, these pouches may grow in the walls of the large intestine, in a gentle, slow flow, a testament to time and the diet's hand, a reminder to balance what we eat to understand. Oh, the tales they could tell. These pouches so deep, of fibers neglected and diets asleep in the world of the gut where quiet secrets keep. Diverticulosis lurks in a slumber so deep. but heed the call of these silent sentinels old to cherish our health, to be brave and bold. For in the care of our bodies we find the greatest gold, a life rich and thriving, a story beautifully told. So let's sing a song of fiber, of meals well rounded and right, to keep these pockets at bay and out of pain and out of sight, in the dance of health and nourishment, in the glow of wellness light. Diverticulosis remains a gentle, silent night. I'm a poet. I was born to be a poet. I was born to be a poet. As always, keep your head up. You're doing great. You're better than what you were yesterday. And that's a lot. Learn something new today. Going to be a great doc. Sometimes you just got to hear that.